And this time we're downright proud to salute a great organization here in town along with our friends at Stivers Ford in Lincoln. And this morning we're talking about the Central Iowa Kidney Walk, Jackie and Jason. And with us now is Nick Peterson. And this is coming up in just a matter of what, about less than 2 weeks?
Yep, May 9th, next Saturday at the Iowa State Fairgrounds near the Varied Industry Building. We'll be holding the Central Iowa Kidney Walk. It starts at 9. Registration starts at 9. The event will begin at 10. It's a family fun day that we get together and really celebrate the kidney community here in Central Iowa and discuss prevention tips and work to find ways to continue to build awareness here in Central Iowa about kidney disease.
Now, with all the ailments that we can have with our body, you don't always hear about kidney disease or even realize there's a walk that goes along with it, but you were giving us some pretty amazing numbers during the break.
Yeah, 1 in 3 people are at risk for kidney disease in America. The leading causes of kidney disease are diabetes and hypertension, or high blood pressure. So, those things are now becoming very prevalent. We talk about obesity and how, diabetes and hypertension are so affected by that. Well, kidney disease is also, those are the 2 main preconditions for it. It affects, like I said, 1 in 3, and then about 26 million Americans, which is about 1 in 9, have kidney disease. Most don't even know it because the signs and symptoms of kidney disease are not really pronounced until you're in stage 4 or 5, which is close to renal failure and needing transplant. So, one thing that our kidney walk does is it provides that awareness of those things. It's getting out there and talking to your primary care physician about when you take your yearly physical to go get your urine and blood checked and see how your kidneys are functioning, and then also just whether or not you're compatible to be a living donor, which is
what is a living donor?
A living donor, well, your kidneys are one organ that you can live with one of them. So there's folks like the Iowa Donor Network and others that we partner with to really promote living donation. So if you're healthy and your kidney function and you have a good bill of health, you can donate your kidney to somebody that needs it, and give that person a shot at furthering their life. I think it's something about I can't remember the statistic, but there's multiple people that die every day waiting for a kidney transplant.
Is there a waiting list for something like that?
Yes, and it's one of those things where we're lucky enough at the National Kidney Foundation here in town. We partner with a lot of our medical professionals like Mercy Transplant and the Iowa Kidney Physicians, who can help us again talk about the ways to get involved with doing living organ donation and the different steps to benefit those who are affected by kidney disease.
And this is something, Jason, that we had an engineer here when we first started who received a kidney transplant, and he was telling us the horror stories, and that's really what it was. It was a horror story of what he had to go through on a regular basis before he got his kidney transplant, and the hours and the days he would have to spend every week or every couple of days in the hospital to clean his blood because he did not have functional kidneys. Gotcha. And it was absolutely amazing, and how his life was totally transformed when he finally got his kidney transplant.
And what's great is organizations like the National Kidney Foundation and what this kidney walk does. We've looked at the studies on what's been done in research for kidney disease and the quality of life for people going through transplant, going through dialysis. People are starting within the last 10 years to really see progress in the quality of life that they're getting due to the new medical advances that are happening in kidney disease. But it's only coming about because people are starting to realize how much people are affected by kidney disease due to the high risk numbers.
If they're in one of these high risk groups, and you discuss people who are overweight and have high blood pressure, what do they need to watch out for? And you said the symptoms are not easy to sense.
Yeah, it's a lot of it is looking at your urine, puffy eyes, and then just the kind of the main factors that you would have with diabetes and hypertension, and a lot of it is it's going to your primary care doctor and getting that annual physical and asking, and it is asking your primary care physicians to do the urine and blood analysis to check that functioning of your kidney, and then from there figuring out if it's right to seek out a nephrologist.
Yeah,
Sure.
making
Now,
sure you
are
stay on top
there
of it.
some things that people are doing on a regular basis that are harming their kidneys?
High amounts of sugar, soda, high levels of sodium in your diet,
Jason, you're out.
lack of exercise.
Oh, that's all three of us.
But I mean, those are all just basic things to start out that can help with preventing kidney disease. Yes.
And you can get out and exercise in a couple of weeks here out
Yeah.
at the Iowa State Fairgrounds. So give us all the details again, so if people want to participate.
Sure. May 9th, Saturday, May 9th at the Iowa State Fairgrounds, the Varied Industry Building. It's a 1 mile walk, and it starts at 9 a.m. and goes till 10. And we've got tons and tons of kids activities. It's a very family-friendly event, and yeah, it'll be fun for everyone. And we'll learn a lot about how we can fight kidney disease right here in Central Iowa.
And the color of the day would be
Orange.
orange. Okay. Just double checking.
Great day orange there.
Perfect. So, well, good luck and have fun.
Yeah,
All right.
And hopefully people become more aware.
All right. Thanks so much, guys. I
Thank you so
appreciate all your
much.
help.
It is 9:20. We'll be right back.